Vitamin B12, an indispensable nutrient for human health, quietly sustains numerous critical physiological processes. This water-soluble vitamin plays a central role in forming red blood cells, maintaining nerve health, and synthesizing DNA, the genetic blueprint of life. Despite its significance, B12 deficiency remains a silent and often overlooked condition that can lead to profound health complications if left untreated. Vitamin B12, or cobalamin, is unique in its complexity and source. It is not synthesized by the human body but is obtained from dietary sources like meat, fish, dairy, and fortified products. This dependence on external intake makes populations with restricted diets, absorption issues, or specific medical conditions particularly vulnerable to deficiency. This nutrient orchestrates critical functions in the body. Its role in red blood cell formation ensures adequate oxygen delivery to tissues. It protects nerve cells by preserving the integrity of myelin sheaths, the protective coverings that enable rapid and precise nerve signaling. Furthermore, B12 is a cornerstone in DNA synthesis, ensuring the replication and repair of cellular genetic material. When B12 levels drop, the body's intricate machinery falters, causing symptoms that are as varied as they are debilitating. The insidious nature of this deficiency, coupled with its capacity to mimic other conditions, often delays diagnosis and treatment. Vitamin B12 deficiency manifests through a spectrum of symptoms, ranging from subtle signs to severe complications. The early indicators are often dismissed or attributed to other causes, which can lead to the progression of more serious issues. The nervous system is particularly sensitive to a lack of B12. Individuals may initially experience tingling or numbness, often beginning in the hands or feet. This sensation, known as paresthesia, arises from impaired nerve function. Over time, muscle weakness and coordination difficulties may develop, complicating routine activities. Cognitive functions also take a hit. Memory lapses, difficulty concentrating, and mental fog become more pronounced as the deficiency deepens. These neurological symptoms can resemble conditions like dementia, making an accurate diagnosis challenging. In addition to cognitive decline, mood disturbances such as depression, irritability, or anxiety may emerge, further complicating the clinical picture. The hematological impact of B12 deficiency is equally concerning. Fatigue becomes a constant companion, even after ample rest. This unrelenting exhaustion stems from a reduction in red blood cell production, leading to anemia. As oxygen delivery to tissues diminishes, individuals may notice pale or yellowish skin. Shortness of breath, even with mild exertion, is another hallmark sign of the body's struggle to maintain its oxygen supply. Gastrointestinal symptoms are less common but no less significant. Loss of appetite and unintentional weight loss signal systemic distress. In some cases, individuals may develop a sore, inflamed tongue that appears smooth and red. Mouth sores or ulcers can also form, adding to the discomfort and disrupting daily life. Diagnosing B12 deficiency requires a nuanced understanding of its diverse presentations. Routine blood work often provides the first clue. A low serum B12 level can indicate a deficiency, but additional tests are usually needed to confirm the condition and determine its severity. A complete blood count may reveal anemia, characterized by larger than normal red blood cells. This form of anemia, known as megaloblastic anemia, is a classic sign of B12 deficiency. However, not all cases of B12 deficiency lead to anemia, making further testing essential. Methylmalonic acid, MMA, testing offers a more sensitive measure of B12 status. Elevated MMA levels are a hallmark of deficiency, as this compound accumulates when B12-dependent metabolic processes falter. Similarly, high homocysteine levels, another byproduct of impaired B12 metabolism, can corroborate the diagnosis. In cases where dietary intake is adequate, clinicians investigate potential absorption issues. The stomach and small intestine play pivotal roles in B12 absorption, with the help of intrinsic factor, a protein secreted by the stomach lining. Conditions that affect this process, such as pernicious anemia or gastrointestinal disorders, can lead to deficiency despite sufficient dietary intake. The treatment of B12 deficiency is straightforward in most cases, with supplementation being the cornerstone of therapy. The route of administration depends on the severity of the deficiency and the underlying cause. Oral supplements are effective for many individuals, particularly those with mild deficiencies or dietary insufficiencies. High doses of B12 can overcome absorption barriers in some cases, ensuring adequate levels are restored. For individuals with absorption issues or severe deficiencies, intramuscular injections are often the preferred method. These bypass the digestive system, delivering B12 directly into the bloodstream. Injections are typically administered weekly or monthly, depending on the individual's needs and response to treatment. Nasal sprays offer an alternative for those who prefer a non-injectable option. This method is convenient and effective, especially for maintenance therapy. Dietary adjustments also play a crucial role in preventing recurrence. Incorporating B12-rich foods like lean meats, fish, eggs, and dairy can help sustain adequate levels. For vegetarians and vegans, fortified foods and supplements are essential to meet daily requirements. Failure to address B12 deficiency can lead to irreversible damage, particularly in the nervous system. Prolonged deficiency can cause permanent nerve damage, resulting in persistent numbness, weakness, and coordination problems. Cognitive decline can progress to severe memory loss and confusion, significantly impacting quality of life. Mood disorders may also become chronic, further diminishing emotional well-being. In extreme cases, untreated B12 deficiency can lead to myelopathy, a disorder affecting the spinal cord. This condition can result in severe motor and sensory dysfunction, highlighting the importance of early detection and intervention. Vitamin B12 deficiency is a silent epidemic, often overshadowed by more prominent health concerns. Yet its impact on physical and mental well-being is profound. The subtlety of its symptoms and their overlap with other conditions make it essential to raise awareness about this preventable and treatable condition. Healthcare providers play a pivotal role in identifying and addressing B12 deficiency. Routine screening in high-risk populations, such as older adults, individuals with restricted diets, and those with gastrointestinal disorders, can facilitate early detection. For the public, understanding the importance of B12 and recognizing its symptoms can empower individuals to seek timely medical evaluation. Simple dietary changes, regular supplementation, and vigilant monitoring can prevent the long-term consequences of deficiency. Vitamin B12 is more than a nutrient, it is a lifeline for the body's most vital functions. Recognizing its significance and taking proactive steps to ensure its adequacy can safeguard health and enhance quality of life. The message is clear: do not underestimate the power of this silent yet essential vitamin. And that's a wrap on uncovering the hidden dangers of vitamin B12 deficiency. If you've been feeling fatigued, experiencing strange tingling sensations, or noticing changes in your mood or memory, don't ignore it. These could be signs your body is calling for help. B12 is a powerhouse nutrient, vital for energy, brain health, and overall well-being, and catching a deficiency early can make all the difference. If you found this video helpful, make sure to give it a thumbs up, share it with someone who might benefit, and hit that subscribe button for more in-depth health insights. Don't forget to turn on notifications so you never miss out. See you in the next video.